We've got a very important topic today, and it's a topic that's close to home for me and my family. My mother became ill in the mid 1960s and passed away at the age of 39 from cancer. I was 11, my brother 16, my older sister 13, and younger sister 8. We had no idea how ill she was. We just thought she had upset stomachs a lot. She was an amazing person. She spoke up for what was right. She had a strong moral compass. She was super smart, a leader, and the most wonderful mother. So while I'm so thankful for the 11 years I had for her, I would have loved so many more. And in my late teens, I started having many of the same stomach issues that she had. And when I was 39, the same age she was when she passed away, I was giving birth to my daughter and on 5 medications a day to eat. And that started to make less and less sense to me. So I began to study nutrition voraciously, stress, and emotional mismanagement, and healed my stomach and got off all medications doctors said I would most likely be on for life. So yes, this is a topic near and dear to my heart. And every day I wake up thinking about my daughter and my responsibility to her to be well, be happy, be healthy, so that she has her mom, a fun, healthy, and happy mom for as long as possible. This is such an honor for me to be able to introduce my wonderful friend, colleague, and business partner, Dr. Dee Garcia. Oh, I'm gonna flip my screen here. I've known Dee for close to 20 years. And I think when you get as old as we are, you forget maybe the exact number of years, but you certainly remember the wonderful times, the laughs, the tears, the many late night conversations, the challenges along the way, the successes, all the things she has taught and brought into my life. I am so appreciative. Let me take just another minute to share a little bit more about Dee Garcia. She is a leading expert on breast cancer. She's board certified radiation oncologist. She's a local national speaker on health. She's on the advisory board for the very prestigious Plant-Based Nutrition Conference. She's a former associate professor, Washington University in St. Louis. She's authored over 40 scientific publications and book chapters, and she's listed in Best Doctors in America. She was also on the advisory board for the Susan G. Komen Foundation and the Wellness Community. Dr. Garcia, we so appreciate the extraordinary contributions you have made to your patients, their families, and to all of us. We are very excited to learn from you today. Dr. Garcia.
Thank you so much, Lori, for that kind introduction. And I value our friendship so much. In fact, one of the fondest memories I have is one night when something was happening in your life. You were struggling and you called, it was late at night. And I remember saying to you, why don't you come over? And we cooked green beans together and sat there and enjoyed green beans in front of the fire in my living room. It was just so fun. But what I want to do is start this morning taking you back to my practice. So these 2 pictures show some of the women that I saw in my breast cancer practice. So as Lori mentioned, I practiced medicine for almost 30 years, and my background is oncology and specifically breast cancer. And when I first started practicing, the women that I saw were my age. They were in their 50s and older. But as time went on, I started to see younger and younger women come in, and it was very disconcerting. I just thought, what is going on? Why are these women so young? And this is a picture of 2 such women. They came in with their children. They came in with their babies. And I came to realize how important it was for me to get these women healthy, not just to help them with their radiation and their chemotherapy and their surgery, but to help them with their overall health and well-being. And the stakes to me were so high when I would have these women come in with their children. I knew that it was more than just the therapies that we were offering them. It was so much more, teaching them how to eat properly and teaching them the lifestyle changes that would be so important in moving them forward and keeping them healthy for the rest of their lives. And so let's look at the scope of the problem. How big is breast cancer? It's the #1 cancer in women worldwide, not just in the United States, but throughout the world. So if we look at American women, or if we look at women in the United States, 1 in 8 women will develop breast cancer. That's about 12% of the population. It's very, very significant. So how many cases is that every year? Over 270,000 new cases of invasive breast cancer diagnosed in our country every year. And invasive cancers, that means cancers that have the ability to spread to lymph nodes. They have the ability to spread distantly. So those are cancers that we need to pay attention to. Non-invasive cancers, almost 50,000 cases diagnosed of non-invasive every year. Those are highly, highly curable. The cure rates for those are almost 100%, but it is a flag that you need to pay attention and help those women before their cancers become invasive. And so those large numbers of cases of breast cancer every year equate to 42,000 women dying from breast cancer every year. So the 5-year survival, that's a lot of women that lose their lives every year. But if we look at the 5-year survival for all breast cancers, it's about 90%. So it is a highly, highly curable cancer. And that is the good news. So it's a cancer that I like to say we don't have to be afraid of. We just have to know about. We can see breast cancer in men as well, but it's very rare. In the 30 years that I practice, I saw on one hand the number of, I saw on one hand cases of breast cancer in men. So it is rare in men, but it can happen. So what are the risk factors for breast cancer? All women are at risk. So we really need to pay attention. All women are at risk. The median age is 61. So what that means is that half of the women diagnosed with breast cancer are older than 61, and half of the women diagnosed with breast cancer are younger than 61. Women that breastfeed have a protective effect against breast cancer. So that's good news. We know that breastfeeding is tremendously important for a baby, but it's also important for that mom. Women that utilize hormone replacement therapy when they get into menopause have a slightly higher risk of breast cancer. The hormone replacement has certainly become safer, and so we don't have to worry as much, but it is a slight risk factor. And family history. If a woman has a mother, a sister, or a daughter, a first-degree relative with breast cancer, her chance of developing breast cancer is double the women that do not have that family history. So keeping that in mind, a first-degree relative does raise that red flag. So risk factors for breast cancer, overweight is a huge risk factor. So a woman who is overweight, has a body mass index of between 25 and 30, is 1.5 times more likely to develop breast cancer than a woman who is at a healthy weight. Women that are obese, a body mass index of 30 or above, are 2 times more likely to develop breast cancer. Lack of exercise is a risk factor. And drinking alcohol on a regular basis is also a risk factor. So some things to keep in mind, knowledge is power. It's, sometimes when people become knowledgeable about something, they can hide their head in the sand. Instead, let's become knowledgeable and then know that we can do something to lower our risk. So why is weight a risk factor for breast cancer? It's because of what we call estrogen dominance. Women who are overweight or obese have higher circulating estrogen levels. And it's that estrogen that is the precursor for breast cancer. Our own body fat is the largest source of estrogen in postmenopausal women. In premenopausal women, our ovaries are still producing estrogen, but in postmenopausal women, it's our body fat. And the same thing applies for uterine cancer. Uterine cancers are also tremendously curable because they're usually diagnosed with postmenopausal bleeding, vaginal bleeding. So that's a red flag that something may be wrong. So what are other cancers that are caused by excess weight? There are actually 13 different cancers that we know of, and this is information from the CDC. So if we look at these cancers, 40% of all the cancers we see in our country are as a result of excess weight. And so that equates to over 600,000 cases every year that are potentially curable. So what are these cancers? Uterus, ovary, breast. In men, it's prostate. And in both men and women, colon, rectal, liver, stomach, pancreas, gallbladder, esophagus, thyroid, kidney, multiple myeloma, and meningioma. So those are the cancers that we potentially can drastically decrease by achieving a healthy weight. And so if we look at the cancers that are associated with being overweight and obese, those cancers have been increasing in our country, whereas other types of cancers are actually decreasing. So this is a quote from Dr. Brenda Fitzgerald, one of the directors of the CDC. By achieving and keeping a healthy weight, we can all play a role in cancer prevention. So pretty strong words there. And again, I want this talk to be empowering, having people realize that they have control over some of these diseases that we see in our world. We don't have to roll over and think, there's nothing we can do about it. I hope that at the end of this talk, you see that the measures you can take to reduce your risk of not only cancer, but other chronic diseases are relatively simple. So that's what gets me excited every day in sharing this information. And I want to point out also that when I talk about breast cancer, oftentimes women will say, well, I'm getting my mammogram every year. But mammography is not prevention. Mammography is early detection. So what a mammogram is meant to do is to detect a cancer when it's smaller and before it's spread to lymph nodes, so that the cure rates are as high as they can be. So the average breast cancer diagnosed on a mammogram is very small, about a little bit over 1/2 inch in size. And most of those breast cancers diagnosed by mammography have negative lymph nodes. Only 15% have positive lymph nodes. And we want to see cancers with negative lymph nodes because they do better. They have a higher cure rate. And sometimes we'll use MRI for some women, young women, for instance, that have a strong family history, or women that have breast implants, or those that are carry the breast cancer gene. So there are indications for sometimes doing an MRI instead of a mammogram, or along with a mammogram. So let's look at genetics. And so many people believe that it's our genes that really are responsible for breast cancer. But if we look at the data, only 5% of breast cancers are actually attributable to the breast cancer genes. And those are called BRCA genes, or BRCA1 and 2. So it's less than 1% of the general population. So it's not that many. The vast majority of women have no genetic connection. If we look at these breast cancer genes, they do affect 2% of Ashkenazi Jews. And in people that carry these breast cancer genes, that equates to a much higher risk of breast cancer developing, 50 to 60% versus 12% in the general population. So we do need to pay attention if we are a gene carrier. I like to also talk about the field of epigenetics. This is a field that looks at the role of genes in causing diseases, whether it's breast cancer or it's chronic diseases such as heart disease, diabetes, and so forth. And what this field of medicine has taught us is that genes actually play a small role in disease causation. It's not what our genes do to us, it's what we do to our genes. And we can actually turn that genetic predisposition on or off if we have it. And I'm going to give you some examples. So how do we turn genes on or off? So let's say you have a genetic predisposition to cancer. If you're a smoker, then your likelihood of developing lung cancer or other smoking related cancers goes way up. If you choose not to smoke, then you're actually turning those genes off. If you are in a job that is eating you alive, lots of stress, you're producing a lot of cortisol. If you're overweight and constantly producing insulin, those two hormones can predispose you to a higher incidence of not only cancer, but other diseases as well. And then things from our environment, pesticides, chemicals, lead, heavy metals, asbestos, the pollutants in our world. You know, a classic example is the lead in the water in Flint, Michigan, that has affected, you know, thousands of people there. When I had my first child, I stopped my ChemLawn service. Yes, my lawn was beautiful, but it could be less beautiful so that my children didn't get exposed to chemicals that could affect their health and well-being. And diet and lifestyle is so incredibly important in turning those genes on or turning them off. If we eat healthy food, if we engage in healthy lifestyle, then again, we can turn those genes off. If we're eating unhealthy things, as I'm going to continue with, if we're exposed to, you know, the pesticides and the chemicals and constant stress, then we're going to increase our risk of not only cancer, but other diseases. I love to talk about the root causes of chronic disease. There really are two root causes, either a decrease in blood flow or inflammation. So if we look at the classic disease that's as a result of a decrease in blood flow, that is heart disease. And heart disease is a huge American killer. Over 600,000 deaths from heart disease every single year in our country versus 40-some thousand deaths from breast cancer. So heart disease is the number one for both men and women. And that is secondary to a decrease in blood flow, mostly because of what we eat. Stroke is another one. Alzheimer's. Alzheimer's is a disease very similar to heart disease. Heart disease is a decrease in blood flow to our heart from our coronary vessels being stopped up. Alzheimer's is the same process in the brain. So the same things that decrease or reverse heart disease are the same things that can decrease or reverse, slow down Alzheimer's. And then if we look at inflammation, that is the basic mechanism of cancer, autoimmune disease. Those are on the rise. Multiple sclerosis, Crohn's, lupus, rheumatoid arthritis, psoriasis, examples of autoimmune diseases. So let's talk sleep, because years ago, when I was raising my children and working like a fiend, rushing off to work every day and, you know, early in the morning and getting home late, I thought sleep was a waste of time. I really did. I thought, you know what, I can get by on 4 hours a night. Why waste 3 additional hours sleeping? But nothing could be further from the truth. Sleep is an incredibly important habit of health. And so what happens during sleep? During sleep, our cells get repaired, enzymes get repaired, our immune system becomes stronger, organ systems and tissues are repaired. It's extremely important. So we want to sleep 7 to 8 hours a day. The other thing that happens during sleep is melatonin is a hormone that is produced to help us regulate sleep, and it peaks between 2 a.m. and 5 a.m. But what do? We're sleeping with our cell phones. We sometimes have the television on in the bedroom. We have our laptops close to us, and that light at night disrupts melatonin and therefore disrupts our sleep. Melatonin is also an inhibitor of tumor growth and development. So we all have cells in our body that have the potential to develop into cancer. We all have those cells. And so we want to suppress that kind of activity. Melatonin is one of those hormones. And some very interesting data, night workers, such as nurses that work the night shift, they have a 40% increased risk of breast cancer because their sleep is chronically disrupted. So let's move on to exercise. And this is one of my favorite topics because I love to exercise. I didn't love it when I was working like a maniac, but I love it now because I have time and I have a more balanced life since I left mainstream medicine 10 years ago to help people get healthy instead of concentrating on cancer and chronic diseases. So this is a summary of 70 studies on lifestyle and breast cancer. Women that exercised had an increased survival. Their survival rate of breast cancer increased by 40% from exercise. And why is that? Well, exercise lowers circulating estrogen. And again, estrogen is that precursor for breast cancer. So we can improve our survival from breast cancer by daily exercise. What kind of exercise? Simply walking 3 to 5 hours a week and working up a bit of a sweat, not lollygagging, but some brisk walking there. 3 to 5 hours a week makes a huge difference. And I put up this visual from Time Magazine. Exercise is not a good habit for weight loss. We know exercise is important for overall well-being, to improve our circulation, to lower our stress even, to tone muscles and strengthen our spines and our the skeletal structure, but it's not a good habit for weight loss. A person would have to run 33 miles to burn 1 pound of fat. So exercise is never the thing that's going to help us get to that healthy weight. It's always going to be the food that we eat, but exercise is certainly an important habit. So let's move on to diet. And this is a quote from one of my favorite physician authors, Joel Fuhrman. I have followed him for decades. In fact, when I was practicing medicine and my patients would come in and tell me, you know, my son is sick again, he has chronic ear infections, chronic sore throats, chronic colds, and all of that, I would recommend Dr. Fuhrman's book, Disease Proof Your Child. It's a fabulous book on how to feed our children healthy foods so that we can lower their risk of all of those childhood things that they experience over and over, and ultimately lower their risk of the chronic diseases that happen later. Although we're seeing chronic diseases such as diabetes and hypertension in children that are as young as 6 and 8 years of age. So this quote, "Health is a complicated issue. All causes of cancer and other diseases are not known. Nevertheless, the evidence shows that superior nutrition can prevent the vast majority of diseases, including cancer." So the answer doesn't lie in the prescription bottle. The answer doesn't lie in these expensive therapies and surgeries and treatments that you get in hospital settings and in clinics and the doctor's office. The answer lies on our plate and with the lifestyle habits that we engage in. So this is a visual that's very powerful. I live in St. Louis. It's very much a private school town, although we have wonderful public schools as well. And the picture on the left is a child's tray of the private Catholic girls' school that my daughter attended, Visitation Academy, for those of you that are viewing this from St. Louis. And so myself and another mom who was a registered dietitian went in and talked to the powers that be at the school, and we got their lunch menus changed. But this is the stuff that these kids were eating. Soda and French fries and unidentified fried foods and the brownie. And where are the vegetables? I guess you can call French fries a pseudo vegetable, and maybe the ketchup. But compare that to the picture on the right. I mean, you look at the picture on the right and you just can feel health and well-being, you know, the vegetables and the fruits. So our diet is so hugely important. And here's a couple of studies to hone that in. This was a study of almost 2,500 postmenopausal women, and they were randomized to 2 different diets. Half of them ate the standard American diet, which is about 40% fat, and half of them ate a low-fat diet of 20%. The women in the low-fat diet had a 24% lower recurrence of their breast cancer, 24% lower recurrence of their breast cancer. And so our diet makes a difference. The food we eat makes a huge difference. In the more aggressive cancers, the benefit from eating the lower fat diet was a 42% decrease in their recurrence rate. So this book was a life changer for me. I read it, oh my gosh, 20 years ago maybe, the China study. It's still in publication. It still is as pertinent today as it was 20 years ago. The China study by T. Colin Campbell from Cornell University. He has spent his entire life studying the impact of nutrition on our well-being. And what he found a lot of things, but blood cholesterol is a strong predictor of cancer risk. So when you go to the doctor and your cholesterol level is over 200, that is a red flag that something is not right. And as we bring our cholesterol levels down, we can decrease cancers of the liver, rectum, colon, breast, lung, stomach, esophagus, so many things, not to mention heart disease and diabetes and some of those chronic diseases as well. So what should we be eating? These are the superfoods. It's fruits and berries and vegetables and whole grains and nuts and seeds and beans and other legumes. That's what we should be filling our plate with, and that's what we should be teaching our children to eat. These are the foods that are chock full with antioxidants and tremendous nutrients, thousands of nutrients working in that perfect combination that will lower our risk of every disease you can think of. So let's look at some studies where with regard to plants. So this was a study of 1,500 women, and the women who ate 5 or more servings of fruits and vegetables a day and walked 30 minutes a day for 6 days. That's just 30 minutes. Oh my gosh, we all have 30 minutes to walk. Their survival was 50% higher than the women who did not eat as many fruits and vegetables and did not engage in the exercise. So I want to move on to alcohol because, you know, when we eat, we're usually drinking something. We want our beverage of choice to be water primarily. We can drink coffee, we can drink tea. Those are not crossed off the list, but what about alcohol? Well, alcohol has been classified as a breast carcinogen. And with regard to breast cancer, no amount of alcohol is safe. So even one drink a day, one alcoholic drink a day equates to a small increase in breast cancer. The only alcoholic beverage that has not been found to increase breast cancer is red wine. But that's only if women drink 1 glass of red wine a day, and in men, maybe two glasses. And obviously we don't have to drink red wine every day, but if you choose to drink, red wine is probably the healthiest alcoholic beverage out there. And we think that's because of the substances in the skin of the red grapes. Those substances suppress estrogen production. So you see the common denominator here, decreasing estrogen with some of the foods that we eat, decreasing estrogen with exercise. And then here we have the glass of red wine. Notice how small the pour is though. This is not a huge glass. This is not a 10-ounce pour. This is probably a 4 or a 6-ounce pour. So I love, this is actually my favorite topic because, and that is a topic of soy, because I get asked this probably every day of the week, and especially by women that live on either coast. There is a lot of misinformation circling around about soy. Soy does not cause breast cancer. Soy is a plant-based food. It's one of the healthiest ways that we can get plant-based protein. And so this was a study of over 6,000 breast cancer survivors. And this is an American study. It was published not too long ago in 2017 in the journal Cancer. And what they found is that the women who were in the top 25% in terms of amount of soy that they ate had a death rate of any cause that was 21% lower than women who ate no soy or were at the bottom of the spectrum in terms of their soy consumption. So a lower risk of dying of any death. This wasn't just dying of breast cancer. This was a lower risk of dying of heart disease and diabetes and stroke and, you know, some of the other chronic diseases that we see out there. And there was no detrimental effect in women who had estrogen positive breast cancers. This is a compilation of 14 additional studies of breast cancer survivors and soy. Women who consume soy lived significantly longer. They had a lower risk of breast cancer recurrence. And that was even with just 1 cup of soy milk a day, lowered their risk of recurrence from breast cancer by 25%. Just 1 cup of soy milk per day. But soy comes in a lot of different forms. Edamame is a form that is, you know, particularly healthy. Tofu, for instance. So regardless of whether the cancers were hormone receptor positive or not, regardless of age, soy had a beneficial effect. So soy foods actually help to prevent breast cancer. And they also benefit women who have already been diagnosed with breast cancer. And there are special isoflavones, plant hormones, phytoestrogens, we call them isoflavones. They mean the same. There's one genistein that interferes with cell growth and proliferation. That reminds you of melatonin, doesn't it? Interferes with cell growth and proliferation. So soy can help prevent hypertension, diabetes, heart disease, and women that benefit the most are those that start consuming soy before puberty. So feed your children soy, much, much healthier than cow's milk. And so how to lower your risk of breast cancer by 60%. This was a study of 30,000 postmenopausal women. They were followed for 7 years. None of them had a history of breast cancer. None of them had cancer of any kind. And by limiting alcohol, eating mostly plant-based, and maintaining a normal weight, their risk, their breast cancer incidence was decreased by 62%. So very powerful studies, very powerful information that you can take home. And so getting to that healthy weight is so important. And that is something that I am dedicating my life to, you know, helping men and women get to that healthier place and incorporate healthy habits along the way to keep their weight off. So people do not decide their futures, they decide their habits, and their habits decide their futures. This is a study from the Cleveland Clinic, very powerful study. It shows that if you take someone who's obese, has a body mass index of 30 or above, and you help them get to a healthy weight, all of these medical conditions improve in gigantic percentages. All of these medical conditions can be reversed in gigantic percentages. So if you look over at, on the left side, you can reverse diabetes 83% of the time. You can decrease heart disease by 82%. And at the end of the day, the 5-year mortality rate, the chance of dying of any cause at 5 years is reduced by 89% by going from overweight to a healthy weight. So the data is huge. Again, it's not about prescriptions. It's not about the expensive therapies. It is about basic diet and lifestyle changes. So I now want to introduce and honor my good friend, Lisa. And Lisa is going to share her story and her journey of breast cancer. Lisa, come off mute.
Hi, everybody. Good morning.
Good morning.
Good morning, Dee. Thank you so much for all this great information. I'm busily taking notes as you speak. So easy to follow everything that you're saying. Frankly, I forgot that I was going to contribute a couple of minutes of to the presentation. So I'm very, very glad to be here to gather with everyone and to learn a few things. And I'll begin by saying nearly 10 years ago, at the age of 50, I found myself 40 plus pounds overweight, although I did spend most of my life trying to control my weight. My eating habits were really atrocious. I was either eating with a lot of restrictions, very restrictively, or I was on the other end, very heavily laden with sugar, and overall just horrible. And I was always very tired, stressed, overwhelmed. And worse is I was very often really mad at myself. So, and of course, eating like that, I had my energy levels all over the place. So my exercise was not very consistent, although I really did enjoy walking, and occasionally I got out to run, but there was no consistency, no real pattern to that. And my doctor was after me to get some of that weight off, and she was a bit frustrated, at all my broken promises, but I just simply wasn't able to get my weight under control until I met up and started working with and leaning into a health coach. I just found that whole relationship very conducive, very inviting. I welcomed it into my life. And I was able to get my weight off through that relationship actually very quickly. And when I went back to my doctor in a follow-up visit, she high-fived me. She was so glad at the way I was turning my life around eating and my weight, incorporating a little exercise at the time. And then I showed her actually in that appointment this lump that had showed up quite on my left breast. And honestly, just a week prior, I noticed that lump was there. And I was almost immediately diagnosed with stage 2 breast cancer. I had this underlying hidden health issue that was able to surface through the thinning of my fat tissues after my weight came off. So it was able to present itself once that layer, all those extra layers of fat were gone. And while the whole experience was unpleasant, going through chemo, radiations, surgery, now that I'm almost 7 years out, I'm very grateful. Grateful to be here, number one. So grateful I was able to see my daughter graduate from college. And I'm grateful for that wake-up call, because breast cancer really didn't run in my family. This breast cancer, I was convinced, was a result of the way I was eating and treating my body and all the environmental factors, many of which you mentioned earlier, Dee. So, but now, 7 years out, I maintain a healthy weight, all within a 4-pound range. I've learned to be very consistent in incorporating healthy habits, and that's habits around what I eat, how often I eat, how much I eat. That's habits around exercise, a nice wide variety of cardio and stretching. I get a lot of good restorative sleep now. The changes in my mindset and my outlook are just extraordinarily far more positive. I'm looking into stress reduction practices, and I'm constantly just seeking education about healthy practices because I enjoy it. And while I'm not perfect, I'm always learning and growing, especially in that mindset. So I surround myself with very healthy people, like-minded people, and find this healthier lifestyle so much more fun. I really enjoy it. And I find it so important. It's empowering and very, very positive. So I'm very glad to be here and a part of all of this, Dee. Thank you for the invitation.
Yeah, thank you so much, Lisa. And as we wrap up, I want to share this example. Catherine was the very, and this is not an actual picture of her. Catherine was actually my very first patient when I finished my residency and I was on my own. She had a very large cancer, lots of positive nodes. She was told that she had 2 years to live. And I looked her in the eye and I said to her, if that's what you believe, Catherine, that's what you're going to live into. And so, she finished her therapy. I taught her or I educated her on diet and lifestyle. And today she is very much alive 37 years later. She's never had a recurrence. And so, but the point of the story is that you have control over your health and well-being. Don't ever let anyone tell you that you don't have control or that your life is a finite amount of time. It's simply not true, or it doesn't have to be true. And so we can incorporate these simple habits that, I've covered in this talk to help us become healthier and help us live that vibrant life that equates to longevity. So wrapping it up, this is my recipe for a healthy and happy life. We want to eat good food, move our bodies, maintain a healthy weight. That's so important. The scale is your friend. The scale tells you the truth. It's your reality check. It doesn't judge you. It doesn't criticize you, but it can help us stay on track. So I recommend, hopping on the scale once a week. We want to hydrate, drink mostly water, sleep, lower our stress, breathe, hang out with positive people. There are a couple of studies showing that we become like the 5 people we spend the most time with. So if we're spending the most time with people that are unhealthy or are negative or are angry, who live unhealthy lives, then that's how we become. So hang out with positive people. Adopt a pet. There are hundreds and thousands of pets in shelters everywhere. And you can go there and find a pet that would love to have a forever home. Seek help from a lifestyle coach. Lisa did. It changed her life. And I love that there are people on this call that are coaches and can help us make a difference. And this is my very last slide. Make your children, if you have children, not everybody has children, but make your children your reason, not your excuse. And these are my kids. They are the loves of my life. And it's the reason that I choose healthy instead of unhealthy every single day. Like Lisa, I'm not perfect. None of us are perfect. But what I want to say to you is you have power within yourself to change. Talk to the person who invited you to this talk and go out and make a difference, not only for yourself, but the people that you love and care about.